we're fortunate today to have with us Dr. John Wiesman, who was appointed Washington Secretary of Health by Jay Inslee in 2013. Dr. Wiesman has over 22 years of experience in local public health policy, and he's worked in 4 different public health departments in Washington and in the state of Connecticut. Currently, Dr. Wiesman serves as an adjunct professor at the University of North Carolina's Gilling School of Global Public Health, and he also serves as a clinical professor at the University of Washington School of Public Health. Dr. Wiesman earned his doctorate of public health in 2012 from the University of North Carolina at Chapel Hill. He got his master's degree in public health from Yale University. Join me now in welcoming Dr. John Wiesman.
Good afternoon. It's great to see you all here, and thank you for making time out of your day to join us. And to those of you, they're in Spokane, the nursing folks?
They're in Spokane.
They're like right there?
They're right there, yeah.
For them? All right. Welcome, Spokane. It's good to have you be able to join us today. Well, first of all, let me say it's a pleasure to work as your Secretary of Health and to do so under Governor Jay Inslee, who, for me, really represents values that are important to me in terms of public health. And so it's a pleasure for me to be able to be here today to talk to you about an important topic. But before I do that, I wanted to get a sense of sort of who's in the room here. We know we have nursing students in Spokane, so that's great. What do we have here in terms of, if you're an undergraduate student, raise your hand. All right, good for you. How about graduate students? I understand you only attend sort of seminars on this that are about marijuana. And how about staff and faculty? Great. Hey, thank you for being here as well. As I get a sense, and we'll certainly have dialogue as we go through this, and certainly at the end. But I'm curious in terms of discipline. We know we have. Are there any nursing students here in this room? Yay. All right. Great. And how about public policy? I assume a fair number of public policy students. Raise your hand if you're a public policy. Yeah, one? How about public health folks? All right, so what are the rest of you studying?
Marijuana.
I'm a vet student.
Vet?
Yep.
Okay, great.
Environmental student.
Environmental? Good.
Advertising.
Advertising? All right. Neuroscience? I got a concentration of that in my undergraduate, but I couldn't tell you much about it anymore.
Pre-medicine.
Pre-medicine?
Counseling psychology.
Good. Wow, a nice range.
History.
Political science. Great. Well, this could be an interesting conversation with all of these different perspectives. And are there anybody here from the marijuana industry? Producers, growers, distributors? Great. Well, I might have to call on you for some expertise as we go. So hopefully we'll have a good time doing that. So I guess before, so to speak, before we go into the weeds on this topic, I thought it would be helpful to tell you a little bit about the Department of Health. So I don't know how many of you think you actually interact with public health. In this state, you have a state department, and then you have 35 local health departments in this state. And they're the ones who do a lot of the boots on the ground work, although not all of it. But if you've ever been born, which I think you all have, if you've ever been married, divorced, you or had a baby, you would have data in the data sets that we at the Department of Health have. So you would, if you've been hospitalized in Washington State, you would be in databases that we have. So data is certainly something that we work a great deal from in terms of understanding health of the population. If you drank any water today, or if you've eaten at any restaurants recently, that's part of what public health does in terms of protecting your food, water, and air. And if you've been reading lately about E. coli and the issue around Chipotle, you'll know that that can be something that can actually make people really sick if we're not paying attention to food safety. Although I will tell you that the majority of foodborne illnesses actually occur from homes. And it's the inappropriate handling of food in our homes, or the inappropriate cooking of it. So while we all are so concerned about restaurants, and rightfully so, because large numbers of people go through restaurants, it's also important to remember that this happens in our homes, and that's actually where the largest number of foodborne illnesses actually occur. Wildfires, for those of you who lived through the wildfires out here, either this year or previous years, issues around air quality, asthma, how that affects people, the ability to be physically active. Those are all things that we deal with in the Department of Public Health. And if you or if any of you have had a baby or are intending to have a baby in the state of Washington, you'll get information from the department that describes developmental milestones that you should be looking for, immunization schedules, and all of that. So that just gives you a flavor, or to let you actually know that you may not know or think that you interact with the public health system, but frankly you interact with it every day. And if you're interested in any more of that, we can talk about that later. So we have about 1,700 employees in the Department of Health that work in these various areas, and we have 5 sites across the state. So we have our main offices in Tumwater. Then we have a public health lab in Shoreline, which does all the food testing that we do, or for shellfish industry. We regulate the shellfish industry to make sure it's safe in terms of toxics. We do blood samples and testing for infectious diseases in our lab in Shoreline. Then we have a staff in Kent who do a lot of inspections of healthcare facilities and drinking water utilities. We have folks in Spokane that do the same thing. And then folks in Richland who, guess what you might be doing in Richland? Paying attention to radiation kind of issues down there. So that's a little bit about the Department of Health, just to give you a little bit of background. So I guess if you haven't thought much about public health before, this idea that your health could be influenced by the choices of the legislature as opposed to, say, your personal medical provider can be fairly strange. And that's when we're talking now public policy issues and how you affect the environment that people live, work, play, learn, and worship in. So the choices, though, made by communities that we live in have profound impacts on our health and well-being. Therefore, every person who is eligible to vote has the capacity, and more than that, the responsibility for determining the health of the members of our communities. And I'm going to talk to you about that specifically because a lot of our topic around marijuana has come from the people making some decisions. We're going to talk about that, and we're going to talk then about what your concerns might be about marijuana, and then the 5 things in particular that we're really focused on at the Department of Health. So let me give you a concrete example about how the public impact health. So in November of 2012, Washington State legalized the use of recreational marijuana through a people's initiative, a ballot measure, Initiative 502. So November of 2012 was just 3 years ago. So I'm curious, first of all, if folks in this room, and you can participate, please, too, in Spokane, if you're at least 18 years old, a U.S. citizen, you don't have a court order saying you can't vote, and you aren't under supervision by the Department of Corrections for a felony, go ahead and stand for a moment for me, if you would. This is sort of your public health sort of exercise here at the moment. So you sort of are the population that are eligible in the state of Washington to vote and to determine things like initiatives. So stay standing. And if you're registered to vote, stay standing. And if you're not registered to vote, please sit down.
What if you're not sure?
If you're not sure, let's err on the side of sitting down about that. Right there you go. Okay, so the people who are left standing are the people who are eligible in the state of Washington to sort of set our public policy through ballot initiatives or electing representatives who represent us. Now, just for the fun of it, of those of you who are still standing, please stay standing if you voted in the election last week, and sit down if you didn't. All right, so this is typically what we see. So go ahead, everybody, have a seat. So in Washington, we have 5.4 million adults who are over the age of 18. 3.9 million of them are registered to vote. So 73% of the adult population have the potential to actually affect public policy through the election process. The turnout for this last election was 38% of registered voters. 38% of folks who determined in this last election some potential major tax policy. Tax policy which looked at whether or not there was a 2/3 majority potential in the legislature to pass taxes, and or then the potential to reduce the sales tax in our state. Now, so 38% of registered voters voted. Of all the adults in Washington, that's about 27% of adults. So about a quarter of the people of this state are determining our public policy. And as folks who were in this institute here at this great institution, that's something for us to think about in terms of what we have to do to actually get the citizenry involved in these important dialogues. So getting back now to our example around the legalization of marijuana. Who in this room, by a show of hands, was eligible to vote in 2012 when the initiative was passed? All right, so a decent number of you were eligible to vote at that time. I'm just kind of curious if you voted, or if you think you would have liked to have voted in this, what might have been some of the things you would have been thinking about when this initiative was on the ballot to essentially legalize the use of recreational marijuana? Yes?
Stop putting people through the court system and prisons for marijuana offenses.
Yep, so trying to have better criminal justice policy in your mind in terms of use of those resources. What else? Yes?
Having better regulation on the pesticides and herbicides that are used for growing it.
Okay, looking for regulation on the growing, using of marijuana. Yes?
Understanding the difference between the federal law and the state law on legalization.
Okay, so it's still illegal federally, right? All right.
Compassionate treatment for patients and reducing opiate use.
Okay, so looking at that link of another public health issue, opiate use, and how do we get treatment out there for folks where marijuana from a medical perspective may be of benefit? Oh, no. Anybody
I was
else?
going to say criminal justice system response.
So also concerned about the criminal justice system?
Increasing tax revenue.
Increasing tax revenue, looking at that, and sort of if it's being sold anyway on the black market, how do you capture that then as a revenue? Okay. Certainly those are all the things that people talk about. They're certainly the things that I certainly thought about when I had that opportunity to vote. But interestingly, we didn't talk a whole lot necessarily about health in the sense of what this means to health of youth or adults. Some of it might have been buried a bit in there, but it wasn't probably top on the mind for most of us is what I'm hearing. So the concerns then moving forward. At the Department of Health, I think we hold a unique position. On the one hand, with not only this but other public policy, we act as leaders on all health-related issues at a state level. But on the other hand, often the voters are the ones who either directly liken the situation of marijuana or indirectly by voting for legislators actually make decisions that impact the health of our state's residents. And then we at the department have to work within the lines that people have given us through those votes. When voters legalized recreational marijuana, the Department of Health had to shift to consider how best to promote health in this new environment. As Washington was one, as you probably know, of the first 2 states to legalize the use of recreational marijuana, we at the department stood in fairly in uncharted waters. Really, others hadn't gone before here. So imagine that it's January of 2013. Initiative 502 has just passed, and you were standing in my shoes as the Secretary of Health. What types of issues would you be worried about and why? So if you're the Secretary of Health, this initiative is passed, legalizing the use of recreational marijuana for those who are 21 and older. What would you be thinking about from a health perspective? Yes?
That more minors would be using it.
More minors would be using it. And what about more minors using it?
That could potentially create like health problems and like behavioral problems and stuff.
Okay, looking at what impacts that would have, health problems, behavioral problems. Yes?
That perhaps it was less detrimental to the body than smoking cigarettes, so there's that mindset, and people would then be more inclined to smoke marijuana as opposed to cigarettes, or there would be health, results from that.
Okay, so again, looking at this with smoking and marijuana, less harmful.
Risk of impaired driving.
Risk of impaired driving.
kind of along the same lines as the cigarette, but the adjustment in alcohol drinking compared to marijuana.
Tell me more about that. So alcohol and marijuana.
I mean, based on the studies that I've read, it appears to be that marijuana is kind of across the board less harmful to your health than alcohol is in terms of effective and lethal doses, because you effectively can't overdose on marijuana while it's quite easy to overdose on alcohol.
Okay.
Withdrawal.
So overdose issues, alcohol as a recreational, marijuana as a recreational drug. Yes.
That the government's credibility on marijuana was starting from a pretty low point.
Uh-huh. And why do you think that is, that the government's credibility in marijuana is starting from a pretty low place?
Because for decades the government has said, this is so bad for you, we're making it illegal, and yet millions and millions of people ignored that and used it.
And did die.
Didn't die.
Didn't get addicted to harder drugs or all the rest. And now suddenly the government's saying, oh, this isn't so bad for you that it's illegal. The government being all of us included. And so what's your need for it?
Right. So, and part of this too is certainly about a lack of research, right, on marijuana, in part due to federal regulations about restrictions of research on marijuana. So we're starting from a place of maybe not as much information as we would like. The place that it's being a Schedule I drug. It has no medicinal value according to a Schedule I drug, and that so really it's just bad. And so we're starting from that place, and federal agencies have had that as their policy place where they've been. Now we're kind of turning that upside down with this. Okay. Anything else come to mind for you as sort of health and as if you were the Secretary of Health?
Harm reduction.
Harm reduction. Tell me more about harm reduction.
Both in terms of treatment for people who might find themselves in a dangerous place using marijuana, but also for reducing the use of other scheduled and illegal and illegal drugs. Marijuana can take the place of opiates, for example, and places where marijuana is legal have lower overall overdose rates of opiate use, but all kinds of other drugs.
Great. And harm reduction is certainly a public health concept and value that we deal with. In terms of HIV epidemic, distribute or exchange syringes for injection drug users as a harm reduction method. We'd really rather people not use injection drugs at all, but if you're not at a place where you've got the resources to quit in terms of access to services, or simply you're not ready for that, how do we protect people from getting HIV? So similar concepts in terms of the harm reduction there. Great. Well, these are all really good points. So let me tell you about what I think are the 5 key health concerns that I'm looking at as the Secretary of Health. And since we're talking to a group of highly educated, eager students, I'm absolutely open for additional thoughts and views as we go forward. So the 5 issues that I wanted to talk to you about today are the lack of regulation on the medical marijuana industry and why I think that's an issue with the recreational marijuana industry. Youth and marijuana, so the issue around youth as we described earlier. I don't think anybody mentioned use of marijuana by pregnant women, but that's a concern that we have. We discussed, or somebody mentioned, the use of marijuana in motor vehicle, driving a vehicle. And then the dearth of available expertise of promoting health in an environment with legalized recreational marijuana. Those are the 5 things that I want to talk briefly about, and then we can have some discussion. So let me begin this discussion of the medical marijuana industry by giving you a brief history of the legalization of marijuana. So legislation to protect marijuana users was first introduced in Washington State through a People's Ballot Initiative in 1998, so way back in 98. This initiative provided some protection to individuals who had possession of marijuana and used it for medicinal purposes. However, the infrastructure set forward by this bill was fairly limited. Notably, the bill did not address what we think are several key issues, such as from where these patients could obtain the marijuana products. In other words, commercial growing and selling of marijuana products was still illegal and entirely unregulated. So nothing around the quality of product that somebody mentioned earlier. And for a long time, this situation did not change. Then in 2011, the federal government and the city of Seattle both publicly announced that marijuana was their lowest priority. So while the marijuana industry was still illegal, the number of medicinal marijuana dispensaries in Washington state began to grow until eventually there are allegedly more dispensaries in the city of Seattle for medical marijuana than there are Starbucks. And actually, we think that might very well be true. However, these dispensaries remained completely unregulated and unlicensed, and actually illegal. In the fall of 2012, when voters passed Initiative 502 legalizing recreational marijuana, they passed a very different policy than the one that they passed in '98, that we passed, that those of us who voted on these things passed. In contrast to the previous policy, Initiative 502 laid out very specific regulations around the growth, the production, and selling of marijuana products. And talked about regulating that through the Liquor Control Board. Additionally, 502 placed taxes on all recreational marijuana products. That was the piece of capturing revenue for the state. So when the first recreational sales began in July of 2014, we had two marijuana industries existing simultaneously. So we, the leaders at DOH, felt that this was problematic for two reasons. First, as an unregulated industry, we were worried about the safety of the products that were being sold as medicine. And in some ways, it's kind of ironic to think about the fact that the recreational industry would be more highly regulated than the medicinal, where people are actually ill, presumably, and using it for that. And so wouldn't you want some protections for folks there? And again, this was because that there was no regulation over factors like what types of pesticides or chemicals could be used on the product or what were the appropriate dosages. So there were no testing requirements in place for things like yeast, fungus, mold, E. coli, and solvent residue. And again, if you're ill, you would think that you might want to pay some attention to those things. Secondly, the economic incentives at the time encouraged medical marijuana use even by people who were more truthfully interested in recreational use. And this dynamic made it more likely that folks would be consuming unregulated as opposed to regulated marijuana products. And again, that piece I think is incredibly important because essentially the recreational product was going to be more expensive than the medical marijuana. So unlike the other issues that I'm going to speak today, this issue has been a problem, but it's been relatively solved now through work that the legislature has done, and the Department of Health played a key role in supporting this change. So in 2013, the legislature asked the Department of Health to work with the Liquor Control Board and the Department of Revenue to make recommendations on how to align the two marijuana markets. Together, we crafted a plan to successfully merge the two markets while still ensuring safe access to the patient community. The legislature introduced a bill on these recommendations the following year, 2014, and as it often happens, it didn't pass the first year, but it was successful in being passed in 2015. Senate Bill 5052 creates a single regulated system for all commercial marijuana. In other words, the bill merged the recreational and medical marijuana industries into a single system that incorporated all of the important regulations that had been previously only existing in the context of the recreational marijuana. So these changes go into effect in July of 16, this next year. So we feel like that has sort of been resolved, not without a lot of controversy, not without a lot of debate in the legislature. And if you at all were in Olympia for any of these hearings, the number of people who showed up in these hearings was enormous. And sort of coming to that place of where both of these could exist in a reasonable manner took a lot of work and a lot of political will on our legislators. So the second issue, youth and marijuana. At DOH, youth, the Department of Health, youth are a priority for us. In fact, one of the key goals of our agency is to support the raising of the healthiest next generation, which is one of the key initiatives that Governor Inslee has. So given what we know about marijuana in youth, the legalization of marijuana presented us with essentially two key concerns in this area. First, we had concerns around small children and safety of small children. And then second, we were concerned about youth choosing to use marijuana. So let me begin with the small kids and safety, or as we sometimes call it, the gummy bear and 3-year-olds example. Although they're prohibited in licensed stores, many marijuana products sold by the medical marijuana industry are produced and packaged in such a way that small children might mistake them for normal treats and eat them. For example, if one purchased a marijuana-infused gummy bear, a 3-year-old would have no way to determine if those gummy bears were different than normal, that they would normally eat. And we know the situation is dangerous. Doctors have reported that when very small children accidentally overdose on marijuana, those children can encounter respiratory issues and even respiratory failure, and basically leading to death. And we did see in the Poison Center a large increase in the number of calls to the Poison Center about really young kids consuming marijuana in large doses. So far, we've addressed this issue by placing stricter regulations around what forms of marijuana can be produced and sold in licensed stores, and soon then the medical stores. So marijuana can't be made now especially attractive to children, and marijuana products are placed in child-resistant containers to further protect our kids. Again, none of this was in place for the medical system because we didn't pass that. We didn't pass a regulated system there. So I can tell you, though, that despite our efforts so far, this issue is still a concern for many of us at the Department of Health. And we've supported the Washington State Poison Center, as I said earlier, in their monitoring of this situation so that we can continue to assess the extent of the problem. Now, most people, I think, would agree with the idea that a small child shouldn't accidentally be consuming marijuana. The more challenging situation, however, lies with our older youth. Maybe even some of you in this room. As I said before, our goal at the Department of Health is to support the development of the healthiest next generation, and we want to be aware of the impact that consuming marijuana can have on the health of our youth. For example, marijuana can be addictive, and this is particularly true for youth who are still growing and developing. So adolescents who start using marijuana before the age of 17 are twice as likely to become addicted as they move into adulthood by using marijuana. And about 9% of adults who use marijuana are addicted to it, and about 1 in 6 teens who start using early become addicted to marijuana. So it's about double at about 17%. We also know that marijuana use in adolescents, and especially frequent or heavy use, is associated with the developing of anxiety disorders in younger adulthood, and is correlated with suicidal ideation, personality disorders, and interpersonal violence. Now, correlation doesn't necessarily mean causation, right? So that's one of the things that, by not having done a lot of research on this, is tough to tease out at the moment. Right now, we know they're correlated. But we know for any adolescent, our brains continue to develop until we're about 25. And so the use of any sort of substances as the brain is developing tends to raise concerns for us. And certainly that's true with marijuana. It's why we believe that marijuana is more addictive in youth who are using than in adults, because that brain is still developing. And finally, we know that the teens that use marijuana are more likely to experience school failure and dropout. In part, this is in relation to memory issues, but again, there's this thing of what's causation here. Are the kids who might not do so well in school the ones who are just more likely to be using marijuana? Again, these are questions that I think are fair for us to ask and to look to do some research on to see what we can really understand there, other than simply a causation. So talking to youth about the risks of marijuana isn't entirely new for us at the Department of Health. We've been doing that before the regulated industry came into place. However, the legalization of marijuana creates two new challenges. Firstly, having marijuana legalized and also used as a medicine changes the perceived risk that individuals associate with marijuana. And we're seeing this in our Healthy Use Survey data of the 8th, 10th, and 12th graders, where the perceived risk of marijuana is going down. Secondly, with this legalization, there simply is a greater supply of more accessible marijuana, which means that youth might actually have more access than they did earlier. And this phenomenon is particularly concerning to us, happening alongside the growing vaping industry. You might ask me how these things are associated or related. So I would ask, by a quick show of hands, how many of you are pretty certain that you could tell if someone is smoking marijuana based off its smell? I think a lot of us could. I was in New Orleans for the last few days, just came back late last night, and as a matter of fact, during lunch, eating outside on what's that street in the Garden District, whatever it is. Yep, indeed, we smelled marijuana from around the corner. And I don't think they've legalized it, but they clearly didn't mind smoking it out in public. Now, how many of you have ever stood next to or passed someone using an electronic cigarette or a vaping device? Probably most of us. Can anyone tell what the substances in that device smell like? Yeah. And with marijuana, so they don't give off the odor that you would expect with marijuana. So for us at the department, we're really concerned about this in terms of youth access. We don't really know what youth are necessarily using or consuming in electronic cigarettes. And I will tell you, there's a large opportunity to purchase electronic cigarettes with THC, marijuana preloaded in it, or to buy the e-juice that goes with it. So again, we're concerned about that from a youth perspective. We also don't know if it is being mixed with nicotine, and nicotine being highly addictive would be especially concerning for us if there's both nicotine and THC in it. So for the Department of Health, our historic allies in fighting youth use of marijuana are parents and educators. However, vaping devices and their lack of smell make it harder for parents and educators to identify when youth are using marijuana, as I said earlier. So given these challenges, how is the department attempting to address this? Well, so far, we've done this work by launching public awareness campaigns to educate Washington residents about the health risks of marijuana use, especially among kids. And we've had three parts to this campaign which have evolved. And one thing about policy and people putting forward policy, none of the funds for marijuana work around this actually become available until after you start selling the product and taxing the product, and then having the legislature approve budgets for it. So anything that happened before all of that had to be sort of rounded up with other funding before we could do anything. And we were criticized for this at the department, why we weren't doing more education. Well, there were no monies to come to us until we actually started selling the product and taxing it, and then taking in the revenues, and then the legislature actually appropriating it in the budget. So the first part of our campaign launched in June of 2013, right before essentially the sale of recreational marijuana was legal, and encouraged parents to talk with their children about the impacts of marijuana. And for some of us, this might seem odd, but the issue was with our younger kids in that sort of middle school age and early teens still actually listen to their parents. Unlike some of us who are in our later teens where we want nothing to do with our parents. So it was really felt like we wanted parents to have these conversations with their kids. And how do you have the conversation? What do you talk about? What do you even need to know? And so that was the first phase. The second phase focused on reaching the parents of African American, Latino, Hispanic, Asian Pacific Islander, and Native American youth, which are the populations in which we actually see the highest youth rates so far, and encourage them also to talk to their kids. And certainly if you talk to folks from any of these communities, they have concerns that a lot of the medical dispensaries are actually in their neighborhoods. They're in the poorer neighborhoods where there's more either lower socioeconomic, racial, ethnic communities living, and so really feel like the impact of that is disproportionate to their communities. Ultimately, we're also going to be launching a third campaign phase, which will be oriented specifically at youth. And we're conducting focus groups and research right now with them to understand what they care about, what concerns they have, and what kind of messaging they think would work best for them. The third issue, pregnant women. So I said before that a key goal of the department is to help raise the healthiest next generation. Well, certainly part of that then is looking at pregnancy. And we realize that we can't talk about healthy children and babies without talking about healthy moms and dads. Therefore, another key issue we've considered is the use of marijuana by individuals of childbearing age. So researchers have demonstrated that parents who use marijuana could unintentionally impact the health of their babies. Specific research has shown that marijuana's active ingredients, THC, which is also its psychoactive ingredient, can pass from the mother to the child through pregnancy or breastfeeding. This active ingredient can stay in the baby for weeks after being exposed, and babies that are exposed to this can have problems feeding and delayed physical or mental development. So we're really trying to make sure that pregnant women understand this concern and working with medical providers who are seeing pregnant women to make sure that they're having this discussion with their patients. The fourth issue is drugged driving. So this issue has my immediate attention and that of the chief of the State Patrol, Chief Batiste, is an issue that impacts people of all ages, regardless of youth or adult. And at the Department of Health, we have focused on this issue because of the very direct safety concerns that it poses both to the drivers themselves and everyone else on the road with them. Right now, I know that there's a lot of misinformation out there about the risks of driving while under the influence of marijuana, so let me clarify a couple of things. Right now, research suggests that drivers who are under the influence of THC are twice as likely to crash while driving than non-impaired drivers. And furthermore, when marijuana is mixed with alcohol, which was the thing we talked about earlier, the risk posed by drivers increases exponentially. So these findings are particularly concerning for us that the number of people, the Traffic Safety Commission reports that the number of people involved in fatal crashes who tested positive for marijuana has been increasing. According to a recent report in 2014, they identified 96 drivers in fatal crashes who had been driving under the influence of THC as opposed to 36 drivers in the previous 4-year average. The Washington Traffic Safety Commission has led efforts to address this problem, and they have been implementing a campaign called Drive High, Get a DUI that attempts to emphasize the danger in driving under the influence of marijuana. So unlike general marijuana use, it's still very much illegal to be high and drive, so we can continue to work with our partners to ensure that this type of behavior is discouraged. And I will tell you, particularly concerning to us in the department, is that in the 2014 Healthy Youth Survey that I mentioned earlier, 19% of 10th graders and 25% of 12th grade students report that they've ridden in a vehicle with a driver who was high at least once in the past 30 days. So, again, I'm not sure that everybody fully understands the risks of getting in a car that way. So the last issue, and then we'll open it up for questions and dialogue, is that finally, what worries me when I think about health policy and marijuana is simply how much we just don't know, getting back to that research piece. Working with my subject matter experts, we can make some good guesses about what issues or concerns we think will arise, but we're aware that there will invariably be problems that we won't see. For example, what will the long-term effects of marijuana use be? Are we likely to develop lung cancers from marijuana use? We just don't know. We haven't been doing the research, and we don't know about with regular users. What's that like? What will the legalization of marijuana look like from a health equity perspective? We already know that some of the stores are disproportionately located in low-income communities and ethnic minority communities. And we already know that 10th graders in racial ethnic minorities are using marijuana higher than their white counterparts. So far we've taken 2 steps to try and address this issue. First, we focused on the collection of really good data so that we can clearly define the problem of what's actually happening through behavioral health risk surveys, the Traffic Safety Commission doing those studies looking at people who are driving under the influence. We've also then joined a learning collaborative with Oregon, Alaska, Colorado, who are the other 3 states that have legalized recreational marijuana. And this, given that we're all pioneers in this territory, we're working together to see what we're each learning in our states as we move forward. So with that, in the concerns that I have, I guess in looking at time, I really want to open this up for questions, comments, dialogue, thoughts that you all have.
So we have about 15 minutes for questions. Let me just start off. One of the particular concerns we have here on campus, I talked to you about this earlier, is there's lots of researchers who want to do work on marijuana, both on the consumption side and on the production side. But getting federal permission is very difficult. So is there somebody in the state that is spearheading some discussions to make that process easier, or who's in charge of that?
Yeah. So what we're doing, and what I'm doing as the secretary, is as we meet with federal officials. So when I talked about this learning collaborative, we had folks there from the Centers for Disease Control, and we again impressed upon them the importance of the need for research. And them working with their colleagues at the National Institutes of Health and others. There are a number of things that have to happen to make this research work. Some of this is Congress sort of lifting some of the rules that put in place. It actually put in restrictions in place around research on marijuana. Then there's this issue of how the drug is scheduled. It's a Schedule I drug, which prevents, which basically says there's no medical use for marijuana and prohibits really even research into those areas. So we're pressing along those ways. We're hopeful that the Surgeon General is going to, or actually we're hopeful that the Institute of Medicine is going to get involved in summarizing some of the existing research and the gaps as well. So we're trying to impress upon our federal partners the need for this research. And we're open, I think, to joining in with anybody other sort of more formal requests that people might be putting in terms of legislative requests. So we'd be happy to partner with universities who are looking at how do you guys address this. Yes?
So you mentioned the drunk or the impaired driving, and I believe the number for blood testing is 5 nanograms per deciliter of THC metabolites. The problem I've heard is that number, at least for chronic users, people who use it medicinally, is so low that they'll always test positive for it, even if they're not actually under the influence.
Exactly.
So, how would you, personally, how would you like to address that kind of concern? Because it doesn't seem fair or equitable to put people in jail for something like that when they're not actually under the influence at that particular time.
So it's a really good question. I think it's, again, one of these nuances as we move forward. How do we figure this out? And understanding that various individuals have different tolerances for various, levels of medication. So this is a place, again, where I think we need to do the research. We need to understand what, for folks who are chronic users of marijuana, what is that looking like for them? I'm not sure how we move forward in implementing laws around that then. And I'd be curious to know what your thoughts about how would you implement a standard, how would you actually operationalize this?
Well, there is a researcher at WSU who is trying to develop a breathalyzer.
Right.
And I think that's desperately needed.
So you make a good point, because as you mentioned, this is a blood test. And so this is something that you actually have to have a blood test for. We don't have a breathalyzer test. But even if we had a breathalyzer test, I guess the question would be, is a breathalyzer test for a chronic user,
They're trying to develop it for testing for acute intoxication rather than just a chronic user who's not currently high.
Yes.
Well, kind of in regards to the breathalyzer, I'm not really sure. Would something like that be able to be used for people who use edible marijuana? Because it doesn't appear as though that would be an efficient way of reading the liver metabolites of THC.
These are all these are the exact questions we need to be asking and understanding. Yes. Yeah.
Is there any research out there that correlates chronic smoking of marijuana to COPD, emphysema, anything like that yet?
We do know that heavy users of marijuana have a higher likelihood of chronic bronchitis, and we know that it does impact the respiratory tract. So, like for people who have asthma, this is a particular concern for that group.
This is more an issue with route of administration as well, right?
Right, that's true. So if you're going to eat it, that would be
Or vaporize it.
Or vaporize it. I don't know so much about the vaporizing piece on that, but you're right again. So the method in which one consumes this has an impact on what kind of health effects you would expect to see. Yes.
I think vaporizing still paralyzes your cilia, but I could be wrong. My question is about medical marijuana in children. So we're seeing a lot of, they're calling them marijuana refugees, people moving from states like Texas to be able to get access for their children. I think Charlotte Fiji was one of the famous examples of, she has like intractable epilepsy, and their family has moved to Colorado. So you say you're concerned about the long-term effects of marijuana in children. How do you see marijuana patients who are young and suffering from these diseases fitting in there? And I guess my question is, how would you contrast that with the use of something like amphetamine salts and other behavior-modifying drugs in young children?
Really good question. So part of this too is we have a large number of 20-some states now that allow for the medical use of marijuana. So some of these refugees hopefully will become sort of less of an issue there. Again, I think this is a piece that we need to have better research and understanding. I think we don't know necessarily what the long-term impacts are on kids. And I think we would want to have research studies that actually allow us to track them, enroll them in studies, follow them over time. I think they're great questions, but I don't particularly have the answers for those right now. Yes.
So obviously we've known research has been needed for this for several years since it's been in legislature. So is there like a lack of funding for research on it, or is there currently studies being done? Is there anything being done to help answer all these questions that we obviously need answers to?
Well, a lot of this is about the federal rules, and so if you're going to use federal funds to do any of this research, you are restricted by what you can actually do. And there are some, exceptions that people get, but they're not enough, and that's really the major barrier. Now, if you want to self-fund your research and not use any sort of federal dollars, and some states, frankly, some states are putting state dollars into funding some research on this.
But you still have to have the DEA license, so.
Right. Although there are some places that have marijuana strains that they can actually use, but you're right. So you get the whole problem with the license.
The DEA has even made CBD Schedule 1.
Really?
Yeah. So,
Buy them on Amazon.
yeah, but so as a researcher, you must still
Yes.
have that federal license, and that's where the big roadblock is right now. Federal government, NIH is starting to put more money into marijuana research, so that's a big help. But it's not easy to get a Schedule 1 license, and if you want to do research in humans, you're restricted in where the source of your marijuana can come from. It's extremely limited, and if you want to study different strains, you can't do that right now, so it's hard.
And that is one of the challenges, because there are many strains out there, many different levels of THC, CBD out there. So again, the research questions are also going to be interesting in understanding what it is we want to research, how do we get the best answers to questions, and if we can only have a limited amount of research, now or under these conditions, where do we best invest those? Yes.
I'm pleased that the state will now regulate and test medicinal marijuana, cannabis, as it is recreational cannabis for contaminants. In talking with people in the industry, I get an impression that those parameters set aren't set for how much of one and another contaminant or pesticide can be in cannabis that's legally grown. And I'm just confused, having talked to these folks. Are there certain levels that they test for, and let's say salmonella, but not pesticides?
Yeah, this too is a really tricky area because there are thousands of pesticides out there, and you can't necessarily test for every single one. So we have developed emergency rules at what the testing is, what the requirements are. I don't have those memorized, but they're certainly available on our website. And that's been a challenge because, again, nobody's done the testing to know even pesticides that we approve for food use, again, the route of administration, ingesting them versus smoking it, is there different sort of biochemical and physiological implications to that? So right now people are sort of making best guesses about what should be tested, how and what for. So it's the people who are doing this work are incredibly challenged by finding what is a reasonable path forward. I think you had a question.
Yeah. Excuse me, pardon me there. I'm curious to know if your office has engaged in any partnerships with your colleagues in Colorado, perhaps, or all these other states that are, studying medicinal marijuana. If you've actually established partnerships to maybe make sure you're not duplicating efforts where they don't need to be duplicated, and making sure that you're using resources to the maximum.
Yeah, that's indeed actually exactly what's happening, is that departments of health and whatever regulatory body in each state is responsible for regulating the marijuana industry are sharing notes and lessons learned. That's why we formed this collaborative. We've learned a lot from Colorado, especially around edibles, and some of the challenges around edibles where people were consuming large quantities and perhaps having some psychotic kind of reactions to them, including jumping off buildings, simply not sort of realizing that they had a couple of problems. They didn't indicate what a single serving size was. There weren't necessarily rules in place that the product had to be evenly distributed throughout the candy bar or whatever, So all of this is quite a science. So we've learned from that. We've identified what a single serving size is. We've put rules into place that if it's going to be sold in a bar kind of thing, it has to be scored in a way so you can clearly know that you're getting one single serving and to know that that product is infused throughout. So all of those things are really challenging. Yes?
Oregon's new recreational law allows for home grow operations, but in Washington it's only available to medical patients.
Right.
Do you see that changing, and is there a different concern with that?
At this point, I don't see probably a whole lot of political will amongst our legislators to jump right back into this issue around opening up the laws on this really anytime in the very near future. So I'm kind of thinking what's going to happen is here we're going to have experiments going on around the country, and then it's going to be important that we're learning from each other. And I think that's what we're going to find happening between Oregon and Washington. That's why we do have to have these learning collaboratives. Any question on this side before I keep over here? No? You guys are all good? All right, let's see. Who hasn't asked? There we go.
With the new tax revenue from the legalization, is it adequate to cover all this work that you're doing in the Department of Health?
Really good question. So this is about sort of, we talked about this at the beginning about public policy, right? So at the time when we all voted on this initiative, I don't think, well, we certainly didn't have the McCleary decision, I don't think, at the time when we voted on this. And so since the time we voted on this as voters, the Great Recession has continued to have an impact on state budgets and local budgets. And we've had this McCleary decision, which says that the state isn't living up to its constitutionally mandated requirement to provide basic education. So we're looking for billions of dollars to put into the education system. So that is a long way of saying that the frame in which these dollars are coming in is a very different frame from when we voted at the time and place. I will tell you that the legislature appropriated much less funding for the activities than what the initiatives asked for in terms of going to the Department of Health or other of the state agencies that need to do this work. We're underfunded to do this work, I think is fair to say. The revenues that were coming in, I had just gotten revenue. I don't know if anybody of you know what the first year of revenues were, but from July of 14 through June 30th of 15, the marijuana sales in Washington State were $259 million, and that brought in an excise tax of $64.8 million. So, at the Department of Health for a biennium, we're getting about $7 million to do media campaign to do for over 2 years, so like a little more than $3 million to do media campaigns, educational outreach, targeted outreach looking towards ethnic communities and other communities that are disproportionately affected by this, supporting a hotline to do this. So we're just scratching the surface with this kind of funding.
Time for one last question.
All right, let's see. Yes, I don't think we've heard from you yet.
You indicated that one of the top priorities for the Department of Health is the Health is Next Generation. Is marijuana legalization inconsistent with that goal?
Well, I don't know if I'd say it's inconsistent. It provides additional challenges to that. As I said, concerns around vaping, just concerns around the perception of risk going way down. So I think it's fair to say it's a threat to the healthiest next generation, and to the pardon.
So is poverty.
And so is poverty, right? So is poverty. So is lack of jobs. All of what we call the social determinants of health. Kids who are not getting education that they should be getting, and quality education. The disparities there. So I guess it's one of the many things that pose challenges to the healthiest next generation. Thank you for that.
So I'm afraid our time is up. Before I ask you in joining me in thanking our guests, let me just remind you, if you're here for a class, there's some sign-up sheets out around in the foyer. We're going to take a little break over Thanksgiving holidays now, so for the next 2 weeks we won't have any events. Our next event is on December 9th. It's going to be with our District 9 representatives. They'll be giving us sort of a preview of the upcoming legislative session. The issues will be important in that session. So come back and join us then. Again, that's at noon, same time, same place, here on December 9th. Now, join me in thanking Dr. Wiesman.